Thank you very much. Zolgensma is the only gene therapy for spinal muscular atrophy and the only spinal muscular atrophy treatment designed to directly address the genetic root cause of the disease by really replacing the function of the missing or non-working survivor motor neuron gene 1, SMN1, with a single one-time dose. It remains one of the most critical, transformative, essential gene therapy that provides a lifetime benefit. At the virtual meeting, we presented a number of data, new Zolgensma data that really demonstrates age-appropriate development in children with spinal muscular atrophy when used early. We also have real-world evidence that shows benefit in older children and durability in 5 years post-treatment, and importantly, how newborn screening enables a better outcome for majority of these SMA kids. Thank you very much. So we presented the pre-symptomatic study on patients with SMN1 or 2 backup copies. Respectively, these fall into type 1 SMA and type 2 SMA. And we saw remarkable results where children were able to eat without any feeding tubes. And these children achieved age-appropriate milestones like sitting, standing, and walking. Specifically, when we look at the 2-copy cohort, 80% of those patients achieved the primary efficacy endpoint, which was to sit for at least 30 seconds. And it was clear that majority of those children achieved these milestones, which fall within the World Health Organization window for normal development. A third of these children were also able to stand, and a third were able to walk. None of these children had any events in terms of needing ventilatory support. Neither was there any feed tubing that was required, and no serious adverse events. When we move on to the patients with 3 copies, we also had remarkable achievement in more than 53% of children achieving the primary endpoint of being able to stand for at least 3 seconds. And 40% of kids in this study were walking independently. And as happened in the copy 2 cohort, these kids achieved these milestones in keeping with the World Health Organization development milestone window. Importantly, these results are unprecedented because when you look at kids with this type of disease in the natural history progression, these kids usually succumb to morbidity and mortality within 2 years. So seeing such a result provides the transformative, innovative impact of Zolgensma in spinal muscular atrophy. These results also add further weight and evidence to some of the studies we have done in different types of SMA, in symptomatic SMA, in multiple studies across regions of Europe and the United States of America. And what's remarkable is that the benefit risk remains consistent across the trials, and the transformative efficacy of a one-time essential treatment remains consistent across the various SMA types. SMA remains one of the most critical conditions that is occurring in about 1 in 10,000 children. This disease robs children of the ability to have any motor activity, and children end up being unable to eat, to breathe or swallow, and have a profound morbidity of requiring ventilatory support and failure to thrive with severe, debilitating, irreversible neuromuscular loss and death as a consequence. In the United States, there has been a fantastic improvement across multiple states with newborn screening, and education by various advocacy groups. And we're starting to see an improvement in diagnosis, which is also something we picked up in our real world evidence data and from our registry, where it was very clear that kids who have been diagnosed by newborn screening compared to those that are diagnosed by clinical diagnosis are treated early and importantly do very well on Zolgensma without requiring any other SMA therapies. This therapy is transformative in that it addresses the root cause of the genetic disease in SMA by replacing the missing survivor motor neuron 1 gene. And this is only done as a one-off treatment and provide lifetime of benefits. It also reduces the burden that happens with other therapies of the access to having to go to a hospital multiple times, and also the burden that's around adherence in taking something daily. I just want to finish by saying that Zolgensma has constantly, across multiple studies, demonstrated the transformative efficacy in really showing age-appropriate improvement in children with spinal muscular atrophy in most of the studies that we have done across the different types of SMA.